Welcome to this recording of the ProPlan Veterinary Diet Overview. My name is Laura Hughes and I'm the Nurse Development Manager for Purina. First of all, I'd like to just bring your attention to our technical support helpline. So our email address is vettechline@purina.nestle.com, and this can be used for any query in relation to cases or questions about products, but particularly helpful for those cases where maybe they've got multiple conditions that oppose each other from a nutritional perspective, and you want a bit of support on which diet to go for. So these are the diets that we're going to cover in today's presentation, and this is very much going to be a top-line overview about the nutritional benefits of each of these products and how they're working to support these patients. So as Purina, we've been working in the world of pet nutrition for almost 100 years, and we have 350 vets and nutritionists whose sole job is to research and innovate within the world of pet nutrition. And as such, we have a lot of firsts, which I'll take you on in a few slides' time. Now, as we go through this training presentation, you're going to see that the products have lots of nutritional innovations with them. However, across the range, we focus on three areas. The first is efficacy. So will the animal eat it, and does it help with the condition it's designed for? Convenience, having a concise but comprehensive range, ensuring that you're not having to keep stocks of a large portfolio of products, but you have all of the conditions where nutritional management is indicated that are covered. And then compliance, building on the trust of Purina held by pet owners who may be feeding other ranges, and each product within our range having clear product benefits. So this shows you the full range and how it sits alongside each other. But before we go into the specifics, I'd like to just talk to you about the different formats that we have available. So we have dry food, which is pretty self-explanatory. We have a dog canned product, which is a firm loaf consistency. And then you have the cat can, which is like a coarse pate, and then the pouches, which are a chunks in consistency. We know that particularly for our feline friends that texture is very important, as some of them can be quite texture sensitive. Okay, so I said we were going to talk about some of the first that we had as Purina. So Purina were the first to launch a hydrolyzed low molecular weight diet in our hypoallergenic product. Our Fortiflora was the first proven probiotic for cats. Previously, people were using canine probiotics and hoping or assuming that if they dosed it for the cat's weight, it would have the desired effect. Our obesity management diet was the first to use high protein to promote lean body mass during obesity management. And our JM diet was the first to use high levels of long-chain omega-3 fatty acids for joint mobility. Now, going to our DM was the first diet to be clinically proven to reduce insulin requirements in some diabetic cats, and I'll come on to that later in this presentation. And our canine DM was the first diet to include an amylase inhibitor, and that reduces how much of the carbohydrate content within the diet is absorbed. Okay, so now let's take you through the packaging just to show you kind of and point out some key points for you. So we have different pack colours. So we have light packs for cat and dark packs for dog. We have an engaging pet image. So this is really easy for the owner to identify what species it's designed for. We have veterinary logos to reinforce the accreditation that we have and the recommendation from the veterinary community. And this includes the ISFM endorsement on our cat packs. We have the product name as well as the letters. I don't know why, but in the UK and probably in the rest of the world, we like to use letters within veterinary for veterinary diets. But actually what we want to do is break this down for the owner and make it clear for them what is the main indication for this diet. And then at the bottom, we have three images, which are our product benefits, which I will come on to next. Okay, so when we go to the back of the bag, I said that we were going to talk about those product benefits. So we have the same key benefits that were on the front of the pack, but this time with an explanation as to what each of those benefits does. Now, just while you're getting used to the range, one still might be, if you are trying to explain to an owner the benefits of the product, If you hold the bag of food towards the owner just thinks that you're holding the bag of food up towards them, but actually you're holding the front of the bag towards them, the back of the bag towards you, and you've got those 3 key benefits. I would just note that if you are wanting to use that as a bit of a steal, English is the second language, so be prepared that it'll be the second line down that you want to read. We have our batch codes, we have feeding guides and where appropriate puppy and kitten feeding guides. And then to pull ourselves into the 21st century, we have a QR code. The QR code, if you scan that with your phone, it will take you through to a daily portion calculator. And that allows clients to be able to populate their animal's exact weight in there and answer a few other basic questions, and it will spit them out an exact to the gram amount to feed. So there is no challenge around trying to discern what the feeding guide means and how they interpret it. They can very much do it of, my dog weighs 12.5 kilos. They can type in that it's 12.5 kilos and a few other basic bits of information, and it will spit them out exactly how much they want to eat. We've also got the number of days that this bag will last for the average size dog or cat, and that's particularly helpful when you've got those clients that are going onto this product for the first time, because it will give them an indication of how long that bag might last. And we have a real size product image as well. So the next is our summary sheet, and this is probably one of my favourite tools within the tools that we have, because what it does is it gives you the conditions on the left hand side, the diet that you would reach for, and then nutritionally how that product is working to support that condition. So it's a really good kind of top line key messages of how this product is working to support these conditions. We do also have a printed version of it as well, and that includes an additional column that says pack sizes available. So if you would like a copy of that, please feel free to reach out to your veterinary nutrition partner if you know who that is, or alternatively email us on vettechline@purina.nestle.com and we can organise getting one of those sent out to you. So then we have exactly the same sheet, but this time for our feline range. So again, that's helping you to understand which products you would reach for in that range. Okay, so now we're going to jump onto the different products within the range. So we're going to start with our hypoallergenic diet, which is our hydrolyzed diet. So just in case you're not familiar with the process of hydrolyzation, hydrolyzation is the process of chopping up that protein so that the body would no longer recognize it. So I often like to use an analogy of stars. So our dog product is a single source protein, which is hydrolyzed soya. So if you imagined a soya molecule was a star, if you've got a dog who's allergic to soya or that star, every time that star presents itself to the dog's body would have a reaction. You chop that star up into smaller bits or triangles, that dog's body isn't going to recognize the triangles and will let those in fine. And that's what the process of hydrolyzation is doing. It's chopping it down to a small enough weight that the body would not recognize that that's the protein it's allergic to. Now, the great thing about our hypoallergenic diet for our dogs is that it can be used in all ages, and we've got both a wet and a dry version of it. As I've already mentioned, it's single source protein, which is hydrolyzed soya, and actually that requires less hydrolyzation than some other protein sources, so you run no risk of any kind of issues around bitterness. It is worth making the owner aware of a couple of points. Visually, it's very different. So most owners are used to a traditional brown kibble nowadays, but actually this is a very light beige colour. So if you don't mention that to them up front, they can sometimes be a bit shocked when they first open the bag and are presented with it. The other thing it's also worth mentioning is how digestible this product is. So this has got a digestibility of around the 95% mark. And that means that in theory, for every 100 grams you feed, you're going to get about 5 grams out in return. And so when you think about those dogs that have been going to the toilet very frequently, not very nice quantity and quality, to then maybe going to the toilet once every day, day and a half, that can be quite a big swing round for those owners, and they can find that quite challenging. It is also worth mentioning that the colour of their poos will change as well and will be a lot lighter. To start with, they often seem quite an extreme of that, and it does settle down to a light brown colour. Now, this is the diet you would use for your food elimination trials exclusively for 12 weeks, and then at that point you could challenge those dogs if you you wanted to. If you've seen the improvement in the hypoallergenic, you absolutely can stay on that diet long term. But if you or the client is wanting to do that challenge process, you could look at taking that next step and challenging them either with their previous product that they were feeding, if it was a nutritionally complete and fixed formula product. Alternatively, you could look at something like our DRM, which is our novel protein diet for dogs, which I'll come on to later. So some of the additional benefits that we have within the hypoallergenic diet for dogs are we have those medium chain fatty acids, which are really easy to digest. So they only require a two-stage process to be broken down by the digestive system, and that makes it much easier for that compromised gut to deal with. We also have the omega-3 and 6 fatty acids to support the skin. So when we go on to the cat product, it's very similar to the dog product in relation to it's still that hydrolyzed protein sources, but we do know that for our feline friends, we have to include a meat-based source because there are certain amino acids and fatty acids that they can only get from meat-based proteins. And so what we do with this product is we still lead with the hydrolyzed soya, but we have enough of the meat-based protein in the diet to cover off the amino acids that are needed without causing issues in relation to bitterness and palatability. So again, it's also worth making the owners aware that this is visually quite different. I always describe the cat product as it looks a little bit like something between a Rice Krispie and a Golden Nugget. So again, visually quite different, and it's also very highly digestible, so we would expect a lot less poos. Now, we've also got the omega-3 and 6 fatty acids to support the skin. And within our feline range, we have the STOX claim, and that is about creating an environment that will minimize the development of struvite and oxalate. We have antioxidants, specifically vitamin E, to mop up free radicals. Okay, so now to go on to our DRM, which is our dermatosis diet. So as the name suggests, this is the diet for skin conditions, but it can be used to challenge those adverse food reactions as well. It contains herring pea and rapeseed, which is quite a novel protein. So they're not proteins that you would routinely find in your off-the-shelf dog foods, and it can be used in dogs of all ages as well. So we also have omega-3 fatty acids because particularly when we know that we're looking at skin reactions, there can be a lot of inflammation present, and so we need to support those processes. So some of the additional benefits that we have within our DRM diet are we have arginine that supports wound healing. We have key amino acids that are the building blocks of collagen, and we have omega-6 fatty acids to support the skin barrier. Okay, so now we go on to our canine UR diet, which is our urinary diet. So this is a diet that you can use for both dissolution and maintenance of struvite crystals and stones, and it's also key management in canine urinaries to ensure that you manage infection, because that we know for dogs infection is the biggest factor for them, and 80% of all dogs with a urinary problem is as a result of infection. So if we can get that infection under control, that will support getting the urinary issues under control. So we look at also having moderate levels of protein, and the reason we do that is we know that there is a link between protein and the amount of urease producing bacteria that are produced. So if you have a moderate protein level, you have less of these urease producing bacteria released, and therefore that helps you to get the infection under control. So additional benefits, so we promote an acidic urine, so we've got a target urinary pH of 6, and we've got natural sources of GAGs, which are glucosaminoglycans, which support the bladder lining, and this product also supports the management of calcium phosphate crystals and stones. So now to go on to our feline range. So we've got, again, one diet that covers both dissolution and maintenance of your struvite crystals, but you can also use it for your calcium oxalate and your feline idiopathic cystitis as well. Now, this diet contains reduced fats and optimal protein levels to help obesity, because we know that that's a big risk factor for these patients. So some of the additional benefits of our feline UR is we've got those natural sources of GAGs, which is the glucosaminoglycans, to support the bladder lining. We've got those omega-3 fatty acids to help the anti-inflammatory processes. Okay, so now we go on to the canine EN. So this is the diet you would be using to help manage intestinal disorders in dogs. It's worth noting for the dog product, the EN Dry can be used for all ages, so from puppy through to senior, and we do have puppy feeding guides. But the wet can only be used for up to 5 days for puppy, and that's because it doesn't meet the criteria to be classed as a growth diet in the wet version. But if you do have a puppy with a more chronic GI issue, they can have the dry product long term. Now, we talk with this product about it being lower in fat content because we know that fat is really hard for our patients to break down, and particularly if they've got a compromised gut as well. And part of that fat content is our medium chain fatty acids. So these have a 2-stage process to break them down, as opposed to long chain fatty acids that have an 8-stage process to break them down. So it's much easier in reducing that workload. Then we talk about it being low residue, and this is very much talking about of what you put in, how much can they use, and how much will then need to be passed out by the guts. And this is about reducing the load on that already compromised gut. So the additional benefits that we have in this product are we have prebiotics to help gut balance. We have our omega-3 fatty acids to support the anti-inflammatory effects. We have a blend of soluble and insoluble fibres, and this product is really palatable, which we know will support compliance. So now let's go on to our feline range. So this does work differently to the canine range because it isn't thought that cats struggle with fat content in the same way as dogs do. So this diet is highly digestible or low residue, so reducing that load on the already compromised guts. But for our feline product, we have a limited number of protein sources, and that's particularly helpful if you're suspecting a food response. We have an addition of a prebiotic, which is specifically inulin, which is food for the good bacteria and therefore supporting that positive gut balance. And then we have the addition of bentonite within the dry product, and that is a natural clay that helps to bind water in the large intestines to give you a nicer, more firm formed feces. So the additional benefits that we have within our feline gastrointestinal product are we have the STOX claim to minimise the development of both struvite and oxalate. We have prebiotics to help gut transit and balance. We have our omega-3 fatty acids to support anti-inflammatory processes. We have insoluble fibres to regulate the GI tract, and then the palatability to support compliance. So this is the product that you would use for a body condition score of 7 and above. So if there's one thing that you take away from today's presentation, it's that this product you feed to the animal's current weight. And ideally, you then check their weight every 2 weeks. And as they lose weight, you then reduce their feeding amount using one of the 2 guides, either for weight loss or weight maintenance. And then when they get to their ideal body condition score of a 4 or a 5, at that point, you then use their current weight at that stage to follow the weight maintenance feeding guides. The other benefit of feeding to current weight is that it supports the owners with that transition of diet, because actually they change the diet but the volume of the food isn't being cut back too dramatically, and that then allows you to use the animal's body condition score rather than a potential predicted weight, which is then going to be more accurate for that patient. So how does this diet work? So this diet is high protein to support lean body mass, low fat because we know that is the highest energy producing nutrient, and we want to have a low glycemic index carbohydrates to support that glucose control. So you're getting a nice slow and steady release of energy rather than those peaks and troughs, because we know certainly for dogs that that peak and trough and inability to control their glucose can be a risk factor for diabetes. So the additional benefits for the obesity management diet for our dogs is we've got high protein and added fibre, and these really help with the satiety piece. So that's that feeling of fullness. We've got those low glycemic index carbohydrates to give a more steady release of energy, and we have studies to prove the efficacy of this product. So again, just like our dogs, this is the product that you would reach for those cats that are a body condition score of 7 and above. And we also feed this to their current weight, and ideally would recommend them checking in every 2 weeks and adjusting the feeding guideline as they lose the weight. Again, it's helping the owner to do that transition so that they've got a decent quantity of food, and it is working in similar ways. So high protein to support that lean body mass, low fat because it's the highest energy producing nutrient. But this time we want to provide urinary security. So we know that being overweight is a really big risk factor for cats developing urinary issues, and so therefore supporting that within this diet is really key. So additional benefits that we've got. So we've got the STOX claim. So that's about minimizing the development of struvite or oxalate. We want to support the satiety with high protein and fiber. And then we've got a natural source of those GAGs and omega-3 fatty acids to support the joints. Okay, so now we go on to our NF diet. So our canine diet is the diet you would reach for from IRIS stage 2. So how this diet works is it uses low phosphorus because we want to slow down the progression of deterioration of the disease. We've got adapted but high quality proteins to maintain lean body mass. And we've got omega-3 fatty acids as a natural anti-inflammatory. We also have mild sodium restriction and increased B vitamins due to the increased losses through urination. So the additional benefits we have within this product is it's a non-acidifying diet to minimise metabolic acidosis that you often see with chronic renal insufficiency. It manages calcium oxalate by having low calcium and vitamin D3 levels. It helps in the reduction of urate formation by being a low purine and lower protein diet. And it helps in the reduction of cysteine by providing a urine alkalization properties, moderate levels of sulfur amino acids, and high quality protein. So now to go on to our early care product. So within our feline range, we split it into an early care and an advanced care product. So the early care product is for IRIS stages 1 or 2. Now, when we look at cats, we know that changing their diet can be quite a challenge. And what we really want to consider is looking at them, screening them early, detecting it and starting on the appropriate nutritional recommendation. And actually 11% of cats with chronic kidney disease have been found on routine screening. So if we can start doing that screening before clinical signs appear, then potentially we can catch the disease in the earlier stage, and we can then look at starting to make those changes within the diet. So the early care, as I said, is for cats at IRIS stage 1 or 2. And within this diet, we have moderate protein restriction. We have restricted phosphorus. We have slightly less sodium, so we're slowing down the progression of the disease. We have increased omega-3 fatty acids to support the inflammatory response, potassium and B vitamins to support the losses through urination and blood pressure. So additional benefits that we have for this product. So it has potassium to reduce the risk of hypokalemia. It's got moderate protein to reduce the uremic crisis. It's got those omega-3 fatty acids which help with glomerular hypertension and inflammation, and your B vitamins to compensate for the losses that are linked with polyuria. So now we go on to the advanced stage. So this is from IRIS stage 3 and 4. And it's the logical next step on. So the same principles as the early, but nutrients that were restricted are then further restricted, and nutrients that are increased are further increased. So we have less protein, phosphorus and sodium, and we have increased omega-3 fatty acids, potassium and B vitamins. So additional benefits, we've got the potassium to reduce the risk of hyperkalemia, moderate protein to minimise the uremic crisis, omega-3 fatty acids to help with glomerular hypertension and inflammation, and your B vitamins to compensate for losses that are linked with polyuria. So now we go on to our canine HP, which is our hepatic diet. So this is a product that can be used for puppies from 14 weeks of age, and in most conditions where you are dealing with one of these that have been diagnosed, the animal won't eat it while they're hospitalized. So you normally have to wait for them to be more stable, and then you introduce this gradually to them when they're starting to feel a bit better. So there's no risk of aversion associating the diet with when they felt so poorly. So the benefits of this diet are very much about helping to protect the hepatic tissue and slowing down the progression of the disease. So we use specific vegetable protein sources to help reduce the accumulation of toxins. And we also have copper restriction, which we know is crucial for dogs with copper storage disease. Additional benefits, we have our omega-3 fatty acids as a natural anti-inflammatory. We have prebiotics, which help to reduce the ammonia products. We've got the diet is 62% plant-based and 33% egg, and so that's much easier for the body to break down. We've got our antioxidants, specifically vitamin E and vitamin C. We've got moderate carbohydrate levels, and we've got some MCTs, which are easier to break down. So when we look at our feline friends for the hepatic diet, we still need to have a high energy diet, but actually we need to have adapted high quality protein. So as I mentioned in the earlier presentation, we know that our feline friends can't be on a plant-based diet only. So we have a mix of both plant and animal-based sources, but making sure it's high quality protein that's easy for them to break down. And then we know it needs to be palatable for our feline friends, because if we don't keep them eating, they run the risk of hyperlipidosis A. So additional benefits, we've got increased fibre and prebiotics to reduce ammonia reabsorption and the production. We've got low copper. We've got increased zinc, which counteracts any nutritional deficiencies. And we've got antioxidants to try and slow down the progression of the disease. Okay, so now we go on to our DM, which is our diabetic diet for dogs. So firstly, it's worth noting that the composition of our dog diet versus our cat diet is quite different. And when we look at dogs, what we tend to say is the main area of focus is around consistency. And what do I mean by that? So I mean consistency in relation to what food they're having, their feeding times, what their exercise looks like. Ideally, you'd be reaching for a diabetic diet, but if that isn't an option, the next best thing is to make sure that it's a fixed formula product. And what that means is it's got the same ingredients in the same quantities every single time it's produced. If you have a product that changes its ingredients and is an open formula, that could cause fluctuations in stability of their insulin and their glucose curve. So ideally, we go towards a diabetic diet, but if not, we want to at least ensure it's a fixed formula product. So how does this diet work? So we're using low carbohydrates because we know that carbohydrates are often associated to those peaks and troughs in glucose curves. And we also use an amylase inhibitor, and that actually reduces how much of the carbohydrate can be absorbed. And we're looking for a slow and steady release of energy from this diet. So the additional benefits that we have are that the blend of fibre and carbohydrates, specifically low glycemic index carbohydrates. So you're getting that steady release of energy rather than the peaks and troughs. And we want to look at antioxidants, specifically vitamin E and vitamin C, to reduce oxidative stress, and then support of glucosamine and chondroitin to support their joints as well. Okay, so now to go on to the feline product. So the feline product I mentioned in our firsts earlier is the one that has the clinical study that has been proven that insulin requirement can be reduced in some cats. Now, the study was a small study in that it was 9 diabetic cats. They were all stable at least 4 months prior to joining the study. And what we found was that 3 of the 9 cats were able to completely stop insulin altogether, and 5 of the other 6 were able to reduce their insulin dose. And this is really quite impactful. If you think about sometimes when you've got a newly diagnosed diabetic cat, it can be quite challenging for the owners to work through either the thought of or the reality of injecting their cat. So the fact that you may be able to use diet to support reducing the dose or eliminating the need for insulin is really quite significant. Now, just to be really clear, the study that I've mentioned here was using the wet canned product. So if you are looking to replicate that, we would recommend that you go towards the wet canned product. So the additional benefits that we have within our feline DM is we have arginine, which is in high levels to stimulate insulin secretion from the beta cells of the pancreas. And we've got weight loss feeding guides, as we know that these cats are often prone to gaining weight. Okay, so then we go on to our cardio care product. So firstly, I would like to explain about the study that we did with our cardio care product. So we did a dietary study, and the results of this study after 6 months showed that within the two groups that we had. So we had a control fed group and a cardiac nutrition blend group. The control fed group, none of their conditions had improved and 25% of them had got worse. But when we looked at the cardiac nutrition blend group, 30% of them had improved and only 10% had got worse. What we also did was we looked at the progression through the stages. So when we look at cardiac disease, we look at the ACIVM staging. And what we saw was that 37% from the controlled fed diet progressed from stage B1 to B2 within that 6-month period, but none of the animals within the cardiac nutrition blend group progressed to B2. So what is this blend of nutrients that I'm referring to? So we've got in there a blend that includes medium chain triglycerides that are an alternative fuel source for the heart cells. We've got key amino acids, specifically lysine and methionine, which are the precursors for carnitine. We've got vitamin E, which is an antioxidant. We've got taurine, which maintains contractile function and has antioxidant properties. We've got our omega-3 fatty acid as a natural anti-inflammatory. And we've got magnesium that binds to ATP to deliver energies to the cells. So the additional benefits we saw were that 60% of dogs had a reduction in their left atrial size, and 30% of dogs had improved mitral valve regurgitation, which then reduced their heart murmur. And this is fantastic because what we're showing is that we can slow the progression from stage B1. Okay, so now we go on to our convalescence diet. So our convalescence diet is the diet that you would be using for those inappetent or critical care patients. Now, we do say that it can be used for both dogs and cats, and we do say that it can be tube fed through a 14 French gauge tube when you mix it on a ratio of 1:1 with water. And if you need to use a smaller tube, you need to use a fine sieve as well as an additional step in that process. But personally, I think that's a bit of a faff and probably a little bit concerning. I'd be worried about blocking the tube. So I would say it's probably better for your patients who will eat a spoonful or two and not much more because it's packing a punch. So how does this diet work? So we've got high protein for palatability and to support repair and recovery. We've got a product that is very nutrient dense so that patients that are inappetent are getting a decent amount of nutrients within a small volume. And it is very digestible. So that's making it as easy as possible for that animal to utilize the nutrients within the diet. So the additional benefits we've got are zinc and arginine to support wound healing, vitamin E as an antioxidant, omega-3 fatty acids as a natural anti-inflammatory, and this product is suitable for all life stages. Okay, so now we're going to talk about our neurocare diet. So this is the diet that we will talk about being suitable for age-related cognitive decline and brain function. Now, I can't say much more than brain function on this recording, but what I would say is if you were to go onto an internet search engine and type in Holger Volk and neurocare, you will find a study that references this product in relation to a specific neurological condition. Unfortunately, in order to be able to talk about that condition, there needs to be a PARNOT, which does not exist at this stage. So whilst that doesn't exist, all we can say as the manufacturer is that if you have a look at that study, that will tell you some of the other neurological spaces that you may be able to use this product and see benefits. So the main kind of focus of this diet is the medium chain triglycerides, and they're acting as an alternative fuel source for the brain. So we know that for some dogs, as they age, that aging brain can't get its energy from glucose, and that makes a really big difference. And it's like someone flipping on a light switch. This product also contains arginine to support blood flow to the brain, your omega-3 fatty acids to support brain function and anti-inflammatory, your vitamin C and vitamin E to mop up those free radicals that would otherwise be causing oxidative stress to the brain, and then your MCTs, as I've already mentioned, as an alternative fuel source. And what's really nice is that many years ago, I was doing a presentation to a practice and describing some of the signs of cognitive decline you see to one of my practices, and the nurse turned around to me and said, "Oh, that really resonates because you've just described my dog to a T there." So we had a conversation about her maybe trying her dog on the neurocare to see how she got on. Next time I went into the practice, I saw her again and I asked her if she'd tried it. And she went, "Oh, yes, I meant to tell you, I have tried it. Yes, he hasn't stopped having a go at my other dog." I was like, "Oh, that's not good." And she went, "No, no, no. He always used to put my other dog in its place and he'd stopped bothering, but now he started putting him back in his place again. It's so lovely to see him back how he was." And so what the really nice thing there is that whilst the other dog probably wasn't so happy, she felt like she'd got the character of her dog back rather than just accepting he was getting old and that is what it is. So additional benefits that we've got of this product. So we've got a proven blend of nutrients that we know support the brain, including vitamin B and selenium. We've got those MCTs at a level of 6.5%. So we also have those MCTs within our Pro Plan Senior diet at a level of 5.5%. So this is kind of taking that next step on. So as cognitive decline continues, you can then kind of step up and elevate your level of support. So we then have our Fortiflora, which is our probiotic. So one of the big things for our probiotic is it's microencapsulated. So the easiest way to try and describe this is if you think about an onion that's got lots of layers to it. Our live bacteria sits in the center of that capsule, which is a layered capsule, and the layers of that metaphorical onion peel away as it works through the harsh processes of the upper digestive system. And that means by the time it gets to the GI tract where it needs to do its job, it's still alive and able to do what it needs to do. Now, this product can be used alongside antibiotics and still be effective. We recommend that there is at least a 2-hour gap between. It doesn't matter which way round you do it, but there does need to be at least a 2-hour gap. The only time we say that this product can't be used is in food allergies, and that would be during the elimination trial period. Certainly, we could look at using it to try for a challenge because it is a partially hydrolyzed protein that it sits in, but because we haven't tested the level of hydrolyzation, we don't recommend it during the elimination period. It comes in a box of 7 sachets for your acute GI cases, to give them a 7-day supply, or a box of 30 days. Because we know that for some animals it can take up to 30 days to stabilize the gut. So we've got those kind of balances of the two. Now, we're using a specific strain of probiotic, which is SF68. And as I said, this has been microencapsulated to support the good bug balance. We also support the immune system because around 70% of your immune cells are located in your guts. And so it's really important we keep that good bug, bad bug balance where it needs to be. Now, I'm going to be a bit crude with my analogy here, but if you imagine the worst upset tummy you've ever had, you'll probably remember it quite visually. You've probably had 24 hours where you had the clinical signs of that upset stomach. And then you had 2 or 3 days after that where you just felt exhausted, maybe a bit cold and fluey, shivery, things like that. And actually that's because your immune cells have taken a literal beating when you've had that upset tummy, and it takes them a few days to get back up toward a sort of full working order, which is why you don't feel quite right. So let's tell you a little bit more about it. So the live bacteria sits in a brown powder, and that brown powder is a hydrolyzed protein, and that also means that it works really well as a palatability enhancer. So as much as the primary function of Fortiflora is as a probiotic to help with the good bugs within the guts, it can also work really well for those fussy or inappetent patients as well. It's 1 sachet per day regardless of size, so it's nice and easy in relation to how much you need to give, and it is suitable from weaning and for pregnant and lactating bitches as well. So when we look at our feline range, we still have the same microencapsulation, and it can still be used alongside antibiotics. And so that's really important that we kind of focus on supporting our feline friends in the same way. We also use this product in relation to things like cats with CKD, trying to get them onto the kidney diet. But there's lots of other situations where you can use it as well. Again, suitable for pregnant and lactating queens, and it's 1 sachet per day, just like the dog is. So we then have our JM, which is our joint mobility diet. So this can be used in dogs of all ages, from puppies through to senior, and we have tailored feeding guides in our veterinary product manual. So it's been clinically proven to help mobility and quality of life, and you can either use it proactively or reactively. And what I mean by that is if you know you've got dogs that are maybe breeds that are predisposed to joint issues, you could proactively put them onto the joint management diet, or reactively is those patients that are coming into clinic with maybe lameness or altered gait. So I just want to take you through one of the studies that we did. So we had a study with 146 dogs who'd been diagnosed with osteoarthritis or a related joint condition. We put them on this product for 2 months and we assessed their mobility at the start of the trial, 1 month in, and at the end of 2 months. And the results were really impactful. So what we saw was that 88% of owners and 90% of their vets saw an improvement to gait and mobility within 2 months of going on the diet. Now, it may not sound like there's much difference in that as a result, but actually, when you think about an owner who invests in a treatment plan, is kind of willing it to work. Whereas a vet is going to be using that cold, hard clinical judgment, and so it's more indicative of the response that you've seen. So the additional benefits, we've got another study that we did, which was 45 dogs this time, and it showed that the JM alleviated those clinical signs of the joint disorder. We also look at high protein to maintain lean muscle mass because we know that's really important to help support those joints, and moderate fat because we know that being overweight will put more pressure on the joints. From a feeding guide perspective, we have puppy feeding guide, adult feeding guide, senior feeding guide, and a weight loss feeding guide. So it really is suitable for all life stages and all life needs. Okay, so now we'll look at Hydrocare. So our Hydrocare is a nutrient-enriched water containing osmolytes. Now, in case you haven't heard of osmolytes, they are molecules that help to regulate water movement across the cell membrane. Think about your GCSE biology and osmosis. They come from whey protein and help to increase hydration and urine dilution. There may be many conditions where a cat may benefit from a higher fluid intake. Can you think of any? So conditions such as FLUTD, chronic renal insufficiency, constipation, diabetes, and even your senior cats may benefit from this product. It is designed as an addition to the cat's normal food and water, and we call it a third bowl. So it comes in an 85-gram pouch and is a soft liquidy jelly, and it's recommended that you feed 1 pouch per 2 kilos of body weight. It can be offered at the same time or separately to the main meal. So now we'll look at the nutritional benefits of this product. So this has been created to increase the water intake on cats, and the study we've done has shown on average they'll drink up to 50% more liquid every day than on water alone. We also see that it is shown to help urine dilution, and this can be measured to see a decrease in urine specific gravity. And because it is this great tasty jelly, it encourages them to take it on board and therefore reap the benefits. So that's me done for today. Thank you so much for taking the time to listen to this training session. If you have any questions or you need any other help or support, please reach out to us, as I said, on our email address, which is vettechline@purina.nestle.com. Thank you so much and have a great day.